Hello, students. This is Alan Gilmore, and we are into Chapter 8, Modular 8, entitled Healthcare. So the state of healthcare in the United States. Let's start, as we almost always do, with some definitions. So in the very broadest sense, we are defining healthcare as the care that's provided to individuals to prevent or promote recovery from illness or disease. So I think that's a good, broad, strong working definition, talking about both preventing and promoting recovery. So both prevention as well as treatment in terms of illness or disease. Trends in the number of individuals without insurance, the uninsured, has historically reflected changes in economic conditions. So in other words, when we are experiencing economic challenges as a country, we find that that is often the point in time where we have a larger percentage of our population who are uninsured. The number of uninsured people increases during poor economic times when people lose their jobs. And as we're going to learn as we get further into the modular, many people's health insurance or access to health care has a direct relationship to their job. Social welfare programs provide a safety net during these poor economic times and can prevent many from going without insurance. Most of the uninsured are in low-income working families. In 2013, just prior to the implementation of the Affordable Care Act, the picture of families without health insurance coverage looked like this. Nearly 8 in 10 were in a family with a worker. So here was a family without health insurance, uninsured, whose family members were employed, but most likely not having health insurance be a part of the benefit package that they receive from their employer. And nearly 6 in 10 had family income below 200% of the federal poverty level. So we were definitely talking about what we spoke of in the last modular, Modular 7, about the working poor. So why are so many people uninsured? Most Americans obtain health insurance coverage through an employer, but not all workers are offered employee-sponsored or employer-sponsored coverage. Also, not all who are offered coverage by an employer can afford their share of the premiums. So there's various kinds of health insurance programs that may be associated with an employment situation. Some may have very little cash that needs to come out of the pockets of the employee themselves, but others, depending on the type of insurance they choose that their employer is providing, or possibly even the number of family members that they have on the policy, can result in either higher deductibles or higher premiums, of which the employee becomes responsible for. In 2016, 46% of uninsured adults said that the main reason they were uninsured was because the cost was too high. Either they had tried to purchase insurance independent from being in an employment situation. When they added all of their family members, it resulted in too much of a deduction coming out of their paycheck if they were employed. Their share of cost may have been way too high. Their deductible may have been high. So all of those are contributing factors as to why some uninsured were uninsured because the cost was just too high. In 2016, the average annual total cost of employer-sponsored family coverage was $16,834, and the worker's share averaged $4,823 per year. Between 2004 and 2014, total premiums increased by 69%, and a worker's share increased over 81%. Gaps in eligibility for public-sponsored health insurance coverage, things like Covered California, in the past have left many without an affordable option. So we're going to spend some time as we get further into the modular to really talk about why is healthcare so expensive? Why are the costs so high? So high that it results in so many people not being able to afford it at all. Baseline estimates show that over 41 million individuals were uninsured in 2013 prior to the start of the major Affordable Care Act coverage provisions. But significant changes have occurred in healthcare delivery due to the Affordable Care Act. So first of all, it was signed into law on March 23rd, 2010 by President Barack Obama. The law was to be implemented over a 10-year period. So the implementation period actually concluded last year. And the Affordable Care Act was to implement sweeping reforms to the US healthcare system. The Affordable Care Act resulted in a number of new requirements and benefits. So there were tax credits for small employers to encourage them to participate. So if you were a small employer previously not providing health insurance to your employees, you were provided with this tax credit as an incentive for you to implement the Affordable Care Act for your employees. The establishment of health exchanges at the state level was created, and those exchanges were used as ways of being able to purchase private health coverage at a dramatically reduced rate. The Affordable Care Act expanded Medicare, or what we call in California Medi-Cal, coverage to many low-income individuals in states that expanded, and marketplace subsidies for individuals below 400% of the poverty line. So we saw for the very first time in a number of years a significant expansion of the Medi-Cal program in California. If a state chose to participate in the Affordable Care Act, part of the requirement was that they had to also provide expansion of the Medi-Cal, or what is called their Medicare program. Let's talk a little bit about that so it's not too confusing. At the federal level, the funds that become available to support medical services for low-income individuals in a given state is called Medicaid. So at the federal level, when the federal government gives money to California to implement healthcare services for low-income individuals, the money that's coming in is referenced as Medicaid. The program that we operate in California using those Medicaid dollars is what we call Medi-Cal, and every state calls it something a little bit different. So just so we make sure that we're clear on that. Tax penalties were placed on anyone who was not enrolled in some form of health insurance. Probably one of the most controversial pieces of the Affordable Care Act was the provision that required that if a person if they did not have health insurance, either through their employer or through another source, and they chose not to participate in the Affordable Care Act, there was a tax penalty that would be placed upon them at the point that they filed for their income tax. And the older you were and the more money that you made, as long as you had not secured health insurance, the higher the tax burden would be. And over the last several years, that provision of the Affordable Care Act has been eliminated. But it was, at the beginning, one of the most controversial pieces about the Affordable Care Act. So the Urban Institute, which is a research group specifically looking at policies and program implementation, conducted an evaluation of the Affordable Care Act as of September 2014. And the evaluation found that due to the Affordable Care Act, there was increased competition, which resulted in lower premiums in some areas. Each state implemented the law differently. The state that implemented the expansion of Medicaid showed, or what we would call in California Medi-Cal, showed significant drops in the number of uninsured in their states. So as we began to expand the availability of Medi-Cal, that was another contributing factor that reduced the number of uninsured in our state. A good marketing campaign contributed significantly to meeting the Affordable Care Act's enrollment goals. So it was important to get the word out and to really inform everybody about this new program that was available. Sufficient access to care was essential to the success of the Affordable Care Act. This, of course, is always the sort of the dilemma that we have in terms of healthcare, and that is it's perfectly fine to have health insurance, but if you don't have a doctor or a hospital or a clinic that's located in your community in a way that's accessible and that you can access, it's fine and well that you have the health insurance, but now you can't use the health insurance because you're not able to find a physician. And those barriers can be manifested in a number of different ways. If English is not your first language, but you can't find a physician who speaks your language, that could be a challenge. If you don't have adequate transportation and there's no public transportation to be able to get you to a doctor's appointment, if there's issues around disability, that creates access problems. So again, if you're in a wheelchair or if you're physically disabled, so it's not simply the fact that there's not services that are located in your community, but they just may not be accessible. And finally, any state that implemented the Affordable Care Act programs needed a strong technological platform to support it. So in other words, there were a number of different states, and if I recall, I believe California was included, that on the first day that covered California, which was what we called the Affordable Care Act in California, the very first day that covered California became available for people to sign up for, the website crashed. So because so many people were trying to get on. So you have to have a really robust technological platform to be able to manage all of the people who are trying to access the services and sign up for them. And I wanted to go back to one thing really quick. These health exchanges, again, if you understand the concept of sort of economics, and particularly the economics of healthcare and private insurance or public insurance, the more people that you have signing up for the program, the lower the cost is going to be for each individual. So having these health exchanges and having a limited number of health insurance providers that were going to be designated as those health insurance companies that were going to be operating the Covered California program in California, there was a way of being able to reduce the costs individually because so many individuals were maximizing and utilizing those particular programs. So that's one of the benefits of having a thing like the Affordable Care Act. So the initial enrollment in 2014 resulted in 8 million people signing up for across the country for whatever their individual state's version was of the Affordable Care Act. Again, in California, it was identified as Covered California. When fully implemented, the Affordable Care Act was expected to cut the number of uninsured by 60%. But of course, there are still some who, even with the Affordable Care Act in place and Covered California and Medi-Cal expansion, there will still be and still continue to be some folks who are operating without health insurance. And that can be due to the fact that there might be no coverage available in their area. We mentioned that a few minutes ago. Some choosing to pay the penalties instead of enrolling in coverage. That's no longer an issue because that provision's been eliminated. Undocumented immigrants are not eligible for the program. Those not enrolled due to language barriers, not familiar with the program, or due to a distrust in government. And the Affordable Care Act success was dependent on outreach efforts and strategies, making enrollment and retention simple and affordable. So how does the lack of health insurance affect access to health care? Well, it just makes sense that if you are an individual or a family without health insurance, that you're less likely to receive preventive care. Often, if someone is experiencing some kind of illness or physical condition, they may postpone trying to access assistance or services. They may be diagnosed at a later stage in the disease where maybe there's less options for treatment. They may choose not to fill prescriptions or not to participate in additional treatments. Excuse me. They may be turned away for services due to their inability to pay. Always the last resort in terms of anyone who's experiencing a serious illness is the emergency room. And the emergency room results in services often being more expensive, and often people who are using the emergency room for some of these kinds of things that they could be going to a primary care doctor for, that's not the intent or the reason that an emergency room exists. Emergency rooms are in place to be able to address emergencies, not the fact that somebody maybe is running a fever or is experiencing stomach pains or something like that. Will often require hospitalization as a result of postponing treatment due to a lack of resources to cover the cost of care. And the uninsured have significantly higher mortality rates than those with insurance. So because of the fact that they delay treatment, they may choose not to secure the pharmaceuticals that would help them with whatever their disease process is, that they're using the emergency rooms, they're postponing treatment. All of this often results in the fact that they are at higher risk of dying from whatever it is that they are suffering with. In 2015, nearly 40% of uninsured adults said that they had outstanding medical bills, and a fifth said that they had medical bills that caused them serious financial strain. So again, this is another sort of outcome of individuals not being able to afford the healthcare that they have and needing supplemental support in terms of affording the healthcare that they have. Research has suggested that having insurance can decrease the likelihood of depression and stress. People often worry about their health. They worry about their children's health, their spouse's health, and that may result in depression or stress. Healthcare expenditures are expected to increase to $4.3 trillion by 2020. And currently healthcare spending in 2016 represented 18% of the US gross national product, or GNP, and $9,807 per person in the US. So what that means is, again, the US GNP, if we took all of the money that everybody in the country earns, about 18% in 2016 was being spent on some form of healthcare. Okay, so we're going to take a break here. Again, this is Modular 8, Healthcare, and I would encourage you, as a part of the next video, the next lecture, to take a look at the video related to Aaron Brockovich, because the next lecture has some information there that relates directly to that video. So and we will pick it up with the next video lecture. There will be 3 videos as a part of this modular in terms of the lecture. Okay?